Coming up on today's episode of the Health Review.
Do what you want, but know what you're doing. So if you don't want to go on HRT, absolutely fine, but make sure that's an informed decision. There is no organ spared, no cell in our body that does not have estrogen receptors or some involvement of estrogen. In the chronic pain clinics we do, 95% of patients, if not more, are female. They're within a certain age range. Started with joint pains, weight gain, mood changes, just so much I couldn't recognize myself. The skincare that worked in your 20s and 30s may suddenly not be effective. Your makeup might not sit well, and we need to have a more personalized and bespoke skincare plan.
Hello, welcome back to the Health Review. Thanks for joining. And on today's show, we're going to be looking into a phase of life that every woman goes through, but a phase that is often misunderstood. It's the menopause. When people think of the menopause, they often imagine hot flushes, mood swings, but it really is so much more than that. And here's some stats for you. Up to 60% of menopausal women experience joint and muscle pain. 1 in 2 report problems with their sleep, and more than 50% say that their skin has changed significantly, can become drier, thinner, more sensitive, all potentially due to a drop in estrogen. My guest today is someone who knows all about this. It's Shreya Kane, who's a medical professional with over 17 years of experience, a trained physiotherapist who now specializes in helping women navigate pain and bone health to skin aging, hormonal shifts, and she's bringing both deep clinical knowledge and a compassionate approach to her clients. Shreya, let's break this down. Thank you so much for coming on the Health Review today.
Thank you for having me.
Welcome to the show. I'd love to start with your personal story. So you started off as a physiotherapist. You now specialize in helping women overcome certain symptoms that are affecting them as they go through the menopause. How did you get into this, and were you personally affected by any of this?
Oh yes, absolutely. So generally people get into things when it becomes their pain point, and it definitely was my pain point in my late 30s. So I'm Asian, South Asian specifically, and according to the stats, so we experience menopause 5 years earlier than the Caucasian population. So perimenopause is also that much earlier. And that's how it started, and no one knew. And being a medical professional myself, I wasn't able to connect the dots. I didn't know what was coming for me. So that was really surprising. And started with joint pains, weight gain, mood changes, just so much I couldn't recognize myself.
I'm sorry you went through that.
Yeah, it was tough, but there's something good that comes out of silver lining and all.
Yeah, and what was the moment where you realized, this could be linked to my hormones?
I accidentally came across it. I sat through a talk that I wasn't intending to sit through because I thought, menopause is going to, come at 50s or something. Sat through it and I thought, oh my gosh, I think they're talking about me. That was literally the beginning of it. And that's when I did a deep dive into the world of hormones, menopause, trained with British Menopause Society, and delved into research.
That's amazing. And it's really nice that you've used your experience to then look into helping others, because we know this is such a difficult time for women. Flow, the hormonal tracking app, They recently did a big study which they produced the findings of, and it was to say that actually, perimenopause for many women starts as early as 35.
Absolutely.
Because it can come at least 10 years before. We know that periods just change, hormonal cycles change for women in their 30s quite frequently. So it might not be perimenopause. It could just be heavier periods. It could be worse, PMS. We know that things happen after having children, periods and hormones change. So it's not even, as you say, getting to sort of menopause age that initially everyone thought, as you say, the average age for menopause is 51. So you think when you're in your late 30s, gosh, that's far away for me. But you put the puzzle pieces together. And how did you feel? So what did you do when you found out that perhaps, this could be me? I could be going through perimenopause.
I think for me, the first thing was, what are the options? So I went to the GP to find out if it was a viable option for me. And that is something I recommend to all my patients. find out if it's an option for you. Do your research. There's so much stuff out there. British Menopause Society itself has a lot of information sheets and data for patients, clinicians, all of it. But that was the main thing. And then it was also finding out, a lot of myth busting for myself, the vitamins, minerals. I mean, there's so much marketing about perimenopausal supplements, and it cost a lot of money. Right? But the reality is nothing is going to replace estrogen. It'll make you feel good. They will help the symptoms, but nothing replaces estrogen apart from HRT. So it's understanding that and then doing something about it.
I've spoken about this before on the podcast that we had the Women's Health Initiative study that came out 20 odd years ago. And that really damaged the reputation of HRT. Many doctors became really scared because the findings suggested that it could increase the risk of breast cancer. Now, many of those findings have been disproven through decades of research and other studies. And I think more women are now taking HRT. Doctors are getting more confident with prescribing it. But it is something that I think a lot of people are still a little bit afraid of, which is why I guess it's good to always really do your research, really speak to a professional and work out what's best for you. Estrogen is a wonder hormone, isn't it?
I love it. I love it. I'm going to go with it. Yeah, it's amazing.
What were some of the most sort of surprising or difficult symptoms that you faced that you weren't you were surprised about?
Do you know when it actually started? First, it was the bloating and certain food intolerances, which are now gone. But I couldn't understand how I could wake up and by the end of the day, I would look about 6 months pregnant. And this was every day. My clinicians couldn't figure it out either. That, and then it was hay fever. So I've never had hay fever in my life. And all of a sudden, hay fever out of nowhere. And a lot of people would say, oh, there's a new strand of pollen and things like that. My husband has hay fever. Never got it. So it was just me. So I think these two definitely. Oh, and the weight gain. That was the most devastating for me because that hit me.
And it's weird to think, that estrogen would be linked to so many things, but it's true that we have estrogen receptors all over our body. It really does affect everything. And I'm so happy now that more research is out there, more people are discussing what, the symptoms, the weird and wonderful symptoms like joint pain.
Oh, yeah.
Which is very common. And I think a lot of people didn't know this. You hear now more of frozen shoulder. That's very common. Unexplained pains all over the place. What's going on in the body at that point? So you know quite a lot about the musculoskeletal system. So this is an area which you are specializing in. What's going on in the body in those areas during perimenopause?
So basically, one thing that we know through research is there is no organ spared, no cell in our body that does not have estrogen receptors or some involvement of estrogen. Now, with fluctuating hormones and declining, so that's what research has shown. It's not just estrogen walking out of the door, it's when actually hormones start fluctuating, go up and down, which is your perimenopause phase. That's when we start losing our bones' ability, muscles' ability to pack on more muscle, collagen, which is in tendons and ligaments, our skin, and bone building. So throughout our lives, we have a fine balance of build-up and breakdown. And what happens when estrogen is modulating it and we don't have the right levels of it is we experience more breakdown, so more muscle breakdown, more bone breakdown. And as a result of this, we know, sarcopenia is a condition where we have age-related muscle loss, but we lose power. And that means simple tasks like going up and down the stairs, walking up hills, sitting and standing out of a chair, they become painful. Women have more tendon injuries. So your hip tendinopathy, frozen shoulder, Achilles tendon, wrist pains. They suddenly start getting repetitive strain injuries, and then osteoporosis, the big one, which is really debilitating and a chronic condition.
And I guess osteoporosis is something that comes maybe a bit later for most women. It's sort of you think of it as an elderly woman issue,
yes,
usually.
Absolutely. So osteoporosis, the effects of it will the breakage, bone breaking, the fractures we see later. And when I say later, I mean over 50, not in your 70s and 80s. That's, of course, more. But it starts around your 50s. That's when you start seeing it. But actually, the changes in your bone density can happen from your mid-30s, because that's exactly what research is showing, is the fluctuating hormones that create an unfavorable environment for bone health.
And I guess it's quite telling when perhaps you are used to doing certain activities, perhaps you like to run and suddenly your knees start going more, or you get the tendon pain in your Achilles, or, these little things can start happening. And I guess it's a little bit frightening when you've been used to having a body that operates in a certain way, and then all of a sudden you're finding these pains. Do you think women are often misdiagnosed or dismissed when they present to their medical professional with pain in their joints when they're perhaps 35, 38, like that sort of age?
Absolutely, because as a chronic pain specialist, I saw in the chronic pain clinics we do, 95% of patients, if not more, are female. They're within a certain age range. And what we see with estrogen fluctuations and deficiency is your immune system is hit and your healing ability is impacted. So if you have an injury, it takes you much longer to recover from it. As you lose muscle mass as well, you start getting into zones where you acquire cardiometabolic diseases, rising cholesterol, diabetes, with no changes to your diet or exercise routine. And this then impacts your physical, your muscle and skeletal system and the healing. And generally what we see is it's not just estrogen decline, but being immobile due to pains and other related issues. That's what takes you out of the game faster.
So with your clients who perhaps are coming to you with an injury or with chronic pain around this sort of age, what advice would you give to them?
So it's identifying, first of all, what life stage they're in. Not everyone will be in that stage, but to start making patients aware that, this is something that happens much earlier than you think. You should be aware of HRT. That is an option, but lifestyle management is really big as well. And it's really taking a holistic view to that patient's, to that woman's, symptoms, because it's not just their shoulder. She's not a shoulder. She's more than her knee, ankle, hip. This is a whole human. And it affects her mentally, physically, emotionally, all of it. So a holistic view, I'd say, and making sure they're aware of all the options.
Yeah. And for those who are maybe a bit afraid of HRT, I know that you will probably have a conversation with your clients and you're perhaps not there to prescribe HRT, but you're there to support them in other ways through their journey. But what advice would you give to someone who's a little bit afraid of the estrogen aspect, breast cancer risks still, even though, it looks better than it certainly did years ago in terms of the studies and the information that's out there?
Research. So I send my patients a lot of scientific studies, actually, who are interested in reading it. But there's a lovely chart online that shows you the increase in risk of breast cancer when you're on HRT compared to a lot of other lifestyle factors. And actually, what increases your risk of breast cancer, even more than smoking and drinking, is inactivity. So that is something you want to be aware of. HRT, I wouldn't worry about it that much. Of course, whenever you are having it, you're going to see your clinician who's going to, see you and prescribe it. It's one-to-one case basis. It's not a blanket rule. But I would say do what you want, but know what you're doing. So if you don't want to go on HRT, absolutely fine, but make sure that's an informed decision. Because when women say, well, I did it naturally, I changed my lifestyle. That's brilliant. And that's going to help your symptoms. There's nothing so far till date that can replace HRT. So,
and I guess it's, as you say, it's weighing up the risks. So absolutely. It's, okay, I want to go on HRT because perhaps I've got brain fog, which a lot of women get, which can really knock your confidence if you're working, especially, and you've got to think quickly and you've got to, and something starts happening to you. I'm sure that can be really challenging. So then it's like, well, what else can I do to perhaps mitigate the other risks? So maybe if I go on HRT, I now need to look at the other evidence and start finding a better exercise regime or cutting down on drinking wine in the evenings or these things. So I guess it's always good to have a conversation with any medication you have about what are the risks, what can I do to potentially balance out those risks, what am I doing? And the holistic approach, as we know, is very effective. And I think there's more and more research which now backs up that, the whole sort of lifestyle and holistic approach can be very good for managing your health. But in terms of movement, what kind of activity? So if someone's starting to get aching joints or injuries which they didn't have before, potentially in perimenopause, what kind of exercise is beneficial?
What the research says, what is my favorite, is strength training. So lift weights. If you're new to it, even body weight strength training is effective. we also need high impact. So that's what research is lately pointing to for our bone health. Okay. And that doesn't mean you jump if you're not used to it, but trampoline, like a rebounder trampoline, which is the lowest high impact activity, it's great. I personally love a weighted vest. I have one, and when I go out walking, they do confuse me for a community police officer. But, you know, it's absolutely brilliant. You can put that on, go for a walk. You can adjust the weight as you want. And along with exercise, the biggest nutrient is protein, because there are only two arms to building muscle, which we call muscle protein synthesis. It is weight training, so strength training, resistance training, and it is protein. That's the only way you will build muscle. And unfortunately, due to the estrogen or hormone, not just estrogen, but progesterone as well, all the hormonal fluctuations we experience, we lose muscle mass. And that makes us susceptible to a lot of conditions. And you just don't want to trade that muscle mass for anything.
Historically, like, we just wouldn't have known that muscle mass and bone density can be a big marker for like overall health.
Yes.
It's crazy. Like, the evidence is mind-blowing when you actually read it. And I suggest that those listening now actually take a moment to read some of these studies, because it is really, really fascinating. I'd love to also talk about skin health. Now, I know you also do skin treatments, which is amazing. You're multi-talented. But also looking at the perimenopause effect on skin. Estrogen, as we know, very important. You've got glorious skin.
Thank you.
Beautiful, yes. But you do different kinds of treatments.
Yes.
You have a clinic. I love that you're able to help women in so many ways. And we know that obviously skin is such a big thing for women. Like, you want to look like yourself. What kind of changes do you think women do notice through menopause in terms of dryness, elasticity, things like that?
We have estrogen receptors in our fibroblasts. Now, fibroblasts are cells that produce collagen, elastin, even hyaluronic acid. These are what you produce in your skin naturally. Okay. Now, this is like scaffolding. So if estrogen is impacting your bone, muscle, fat tissue, your skin density, all of it is impacted. And aging or skin changes, they happen at multiple layers. We can't do anything about the fat and the bone and the muscle externally. We can work on the outer layer. But then what happens with the outer layer as well is it's called the epidermis, which is the outermost layer. And in this layer, essentially what happens is we have less moisture. The skin barrier is impacted, again, because of hormonal fluctuations. So, you know, you might see more conditions like rosacea, more breakouts. As the skin is drying, hyaluronic acid, when women apply this externally, it helps them a lot. And you start seeing appearance of fine lines, wrinkles. You lose elasticity in the skin, or pigmentation as well, which is due to damaged melanocytes, the melanin producing cells. So all of these things are happening, and that's what we need to cater to. So the skincare that worked in your 20s and 30s may suddenly not be effective. Your makeup might not sit well, and we need to have a more personalized and bespoke skincare plan to cater to the needs of
That's really interesting.
Skin.
Yeah. And I think sometimes these tweakments or these treatments you can do in a clinic like the one that you run can be quite helpful. We can go through some of them maybe if you don't mind.
Sure.
But like, sometimes when I see a friend who is looking particularly radiant, they might say, oh, I've had Profilo done recently, or something like that, which is hyaluronic acid injected into the skin. In terms of evidence-based treatments, science-backed, are there any few that you think are particularly good for women who are going through perimenopause or reaching that stage?
With my skin clinic, I actually specialize only in regenerative aesthetic medicine. So that is anything that will stimulate your body's own ability to produce collagen, elastin, and make it look more radiant. So it's outside of Botox and fillers. Nothing wrong with them. It's just something I have chosen not to do. In terms of evidence-based treatment, microneedling, exosomes, skin boosters like Profilo, as you mentioned, they are absolutely wonderful. A newer treatment, which not many people know of, is polynucleotides. That's the salmon sperm.
Yes.
Yes. Oh, I absolutely love it, especially for under eyes, because that is somewhere where we lose our volume. For fine lines, wrinkles, or even acne scars, it's absolutely brilliant. So I use that as a primer, and then I will build up treatments over it. It comes with a skincare plan, because consistency is everything. What you do every day for your skin will matter more than anything. And then over time, your skin definitely keeps getting better. And together with this, it's always about taking a holistic approach. It's, collagen supplements, for example, vitamin D, advice on sleep, natural light, an anti-inflammatory diet, and stress management strategies. So all of it.
There's more and more research to suggest that beauty is sort of comes from within, and your gut health, and as you say, your sleep, these things really have an impact. And I can say for myself, when I look back at, because I used to drink frequently in my 20s, and I think I was about sort of 27 or 26 when I decided to stop drinking, and the difference in my skin, just I think there was almost there's an alcohol bloating look for some people, or a dullness in your skin. And I think things like that sometimes you don't notice could be aging you, could be damaging the sort of appearance and the quality of your skin. Sleep, very important.
Huge.
Are there any kind of risks involved? Because I know that for a lot of people, the idea of injecting salmon sperm probably sounds more scary than it actually is, right?
Yeah, it's definitely, it's an amazing evidence-based treatment. Generally, everyone takes a different approach. I would not inject in someone who has allergies to shellfish, although it doesn't have shellfish in it. We try to take a cautious approach. And then other contraindications or things that may make you not suitable for the treatment are discussed in a consultation. So consultation is the most important part of any treatment, whether it's medical, aesthetic, whatever kind of treatment you're going for, because that is the basis on which you build on. That's the foundation. I take a conservative approach, and I often start with a good skincare routine. On that, we can build on things like chemical peels or microneedling, or energy devices like radio frequency and red light if you want non-invasive stuff, which is really good. And then take it from there. Even facial acupuncture, because that's something that I did for people who are completely averse to anything. And that works.
How does that work?
So the principle is similar to microtrauma. It creates microtrauma to your skin, which sets off a cascade of reactions that stimulate your skin to build more collagen, elastin, bring more flow of blood to the surface of the skin, balancing hormones, inducing relaxation. So that's essentially how it works. That's how I started off with as a acupuncture on the NHS as well. That's how I started off, and then built up with the other treatments.
That's fab. Yeah, I love that these options are out there now, and they actually do make a difference in terms of the quality of the skin. And you can kind of tell when someone's been working hard at their skin, because it's sort of just an extra glow or an extra freshness, which it's not anything drastic. It's not like, fillers and Botox and facelifts. It's just something that looks really natural, and it's enhancing, I guess, what you have already. It's just bringing it out and
absolutely
making it shine.
Yeah, resurfacing your natural beauty, sort of. And during this period, we also see a lot of changes to our hair. And some of these treatments are really effective as well at helping with loss of hair. As long as the follicle is still there, you can enhance your hair growth, the thickness. And I have done it personally because I lost so much hair, and I did microneedling and exosome with polynucleotide combination on my hair, and the sort of bald patches, or where the skin was really, the hair was really thinning, that definitely changed. So I'm really pleased, with that, because that is quite important for women.
Yeah, absolutely. Yeah, I didn't know that you could do them on your hair. That's amazing. And in terms of skincare, so things you can do at home, I think most of us know that hyaluronic acid is very good. Most of us know that retinol is good. Do you have any other sort of tips that you would point us to?
So I would say whatever you do, make sure it's consistent. So that will give you the best results overall. Hyaluronic acid is something I use all the time. It makes you feel really good, gives the skin a really nice glow, hydrates it. Retinol, or I use retinol, so that is one step less for your skin to convert it into the acid it needs to.
So is that for people who perhaps have more sensitive skin?
Yeah, it does help with that because it reduces your chances of breakouts. So there are several steps when you start using a retinol or retinoic acid. There are several steps your skin needs to go through to convert it to be in a usable form. And the brand I recommend is, if you can mention brands,
Yeah.
I use Medicate for myself and my patients. It has a retinal technology, and this is the closest you can get to. So that's quite nice, and it doesn't make you have as many breakouts, which is really nice. I've treated some patients with sort of breakouts and acne just with skincare and with maybe just one treatment. That works really well. So that is one evidence-based ingredient. Vitamin C is great. Some peptides can be really good, but the most important also is sunblock. So SPF is really important. For the rest of your body, face and neck, use SPF. For the rest of your body, a thin layer of clothing will protect you. So you don't have to stay out of sun, because sun is broad spectrum light. It has a lot of benefits for your skin, joints, everything. So don't avoid the sun. Just protect yourself, I would say.
That's great advice. SPF 50 every day for me.
Absolutely.
I can't believe the days where we didn't do that. I mean, it's only really been in the last, I don't know, less than 10 years that people are really talking about SPF. Now it's like we all know this. We've seen it all over social media for a long time. But yeah, I mean, in my early 20s, oh my gosh, I can only hope that some of my foundations had SPF in them. Otherwise, I'm going to look very old soon. So yeah, it's great to like get into a routine. The red light as well. Lots of people getting the at-home masks now. Some are better than others, I think. Some have a stronger light than others. So it's, I guess, about doing research. Sorry to interrupt. If you're enjoying today's episode, please do subscribe or give it a follow so we can keep giving you excellent content and bringing on amazing guests that hopefully you're loving on the Health Review podcast. Now, back to the show. We spoke a bit about HRT a minute ago. For someone who's coming to you for general support and help during the menopause, what risks or benefits do you think they should weigh up when it comes to HRT?
So HRT is definitely an individualized conversation. I think your GP is probably best placed to give you this, because they have access to your full medical records. There are certain things that are absolute contraindication to HRT, so current or previous blood clots, hormone-sensitive cancers, undiagnosed vaginal bleeding. I think there are some others as well, pregnancy, of course.
Yeah.
But outside of that, it's going through your personal medical history and then making that decision. So I would say don't be scared of it. Make an appointment. And when you do make an appointment with your surgery, make sure they know that it's for menopause, because these consultations are generally longer. So they have the right time to give you, so that they can go through the entire history and help you make an informed decision.
Oh, that's amazing. I didn't realize they were longer. They need to be, by the way, because
Yes,
most
because
appointments are 10 minutes.
Absolutely. So then your GPs, whoever specialize in it, who see the menopausal patients, they will put aside longer times for these consultations, because it is quite complex. And prescribing HRT, people are still quite cautious about it. So, they want to take their time to know, is it a safe option for you? What else could you do? But one thing on that I would like to say is, there is one form of estrogen, vaginal estrogen. There is a specialist in the States who says this. It's really amazing. I'm going to quote her. There's only one contraindication to vaginal estrogen, and that is not having a vagina.
Yeah.
Right? So it's even deemed safe for patients with breast cancer. And I cannot tell you the number of female patients who would come to me in their 50s, 60s, or 70s who've been put on 6, 7, 12 courses of antibiotics for a UTI. And no one has stopped to think, why is she having so many UTIs? Actually, you put her on vaginal estrogen. It's local. She's fine. She hasn't had that issue for over a year, and it changes her life.
We know the gut health influences the vaginal health. So I had chronic UTIs when I was in my 20s, many antibiotics. I actually don't want to even think about how many courses of antibiotics I went on for bladder infections and kidney infections. And then when you're on so many antibiotics, you then destroy your gut health. Absolutely. And other things start, playing up in your body. So I think getting that balance in your gut, the nutrition aspect, can really have a helpful effect in terms of the UTIs as well. But then there's the layer of also the estrogen, if you're missing the estrogen. So it's kind of fitting the puzzle pieces together. And that's why having a longer appointment is so crucial, because as you say, it's complex. And there are so many weird and wonderful symptoms of the menopause. The list is getting bigger as research goes on.
Yeah.
So it's really up to the doctors to put those pieces together and work out, what is the best route forward here. In terms of diet and lifestyle, as we've been saying, what would you advise? So if someone's coming to you with perhaps not the best diet and lifestyle, what advice would you give to them in terms of perhaps they're having chronic pain and want to improve that?
I would give them all the advice, but I would tell them just start with the simplest thing. And often adding in something into your diet is easier than taking something out. So I always say, think about your protein, because the way I would plan my food is number 1, protein, number 2, fiber, number 3, whole grains, for example, and the variety of it. So protein is so important, because when I have seen my patients who, they're waiting for the GP appointments, waiting for the HRT consultation, we have just changed their protein and worked on sleep. Those two things can change your symptoms by about 60%. And this is all over body pain. Pain is moving around, can't sleep, it's inflammation, whatever. Protein is so powerful. You can get it through your diet. You can get it through supplements, protein shakes. I'm not really affiliated with any brands. I just take whatever, my protein. It's easy. You get it on Amazon. It's easy. So whatever is easy for you, but getting it from your diet, chicken, fish, eggs, we basically have 9 essential amino acids. The reason they're essential is because your body absolutely needs them and your body cannot produce it. So we have to get them from food. Animal sources give you a complete protein. So that means they will have these essential amino acids. When people are vegetarian, it's harder, but there are certain sources such as tofu and tempeh and quinoa, and they have these. When you're taking other sources, it's good to complement it with some supplements which will give you those essential amino acids. But like you said about the gut microbiome, it is so huge. So estrogen and gut microbiome have a two-way relationship. The gut microbiome helps estrogen metabolism, and estrogen impacts the gut microbiome quantity and diversity. And when you change this, it impacts your overall health. So currently in Stanford, there is an entire department dedicated to doing research on gut microbiome and mental health, like mental health conditions. Mm-hmm. It's that powerful.
Yeah. So we know, certain foods are not good for the gut, or alcohol's not good for the gut, but whether we actually, take the measures to really grow and develop our health in that way is another thing. And I guess as part of the menopause, if you can set yourself up for success, then if you need HRT, you kind of know that's the only thing that's left. But if you haven't done the other bits first, you don't really know what HRT or if any you need to go on.
Absolutely. I always recommend, do whatever you can, be consistent with it. Start with the protein, eat more vegetables, eat, like they say, have a rainbow. Sleep is so important, because if sleep is not there, nothing is going to work. So that is the number one thing. And then stress management. And then you can come into supplements, etc. But yeah, like your lifestyle changes, the diet and gut microbiome, all of that is so, so crucial. It makes your HRT more effective.
I guess that's also hard for doctors to distinguish with mental health stuff. How much of it is the menopause and how much of it isn't? Because I think for a lot of women who have gone to the GP, displaying some mental health symptoms, sometimes the first thing that a doctor will say, right, perhaps we'll put you on an antidepressant or an anti-anxiety. Do you think it's difficult to really work out what is hormone and what is something else?
It can be difficult, especially for doctors who are not trained in it, who haven't got much experience in it. Can be really hard. I was offered so many antidepressants because, again, I was in my late 30s. And, you don't put someone in their mid to late 30s, perimenopause, you just don't put that in the same basket. That's what happens. But also, the symptoms are so similar that you don't know. What I normally ask them is, have you had anxiety? Have you had depression before? Is it something new? Because a new onset symptoms generally indicates, it's a much more complex assessment than just this, but new onsets indicate that it could be more hormonal related than that.
Mm-hmm. I'm going to do a quick myth-busting section with you, if you don't mind. A bit like a
Yes.
quick fire round.
Sure.
I have a few questions to ask you. Starting with, lots of people think that the menopause starts at 50. I mean, we've just touched upon this, but what more can you say to that?
Starts much earlier. It's about the hormonal fluctuations, not just the decline.
Is weight gain inevitable?
No, you can. There's ways not to gain weight. If you know what you're doing in your 20s and 30s, build the muscle. There's a thing I always say. I know this is a quick fire, but
No, please.
strong over skinny. Think of nutrition over calories, and think of health or natural foods over processed foods. And that's a great way to go. I compromised. I lost a lot of muscle just trying to be skinny, and I wish I hadn't.
Yeah, and actually the weight loss jabs are something that's perhaps exacerbating this a bit, because you're losing the weight, so you're becoming thin, but there's a lot of evidence to suggest it's not great for muscle mass either, is it?
The problem may not be with the drug. It may be a user problem. So often what people do is they lose weight without increasing their protein and doing resistance exercise. So now they've lost muscle. So they are a smaller version of their previous self rather than enhancing health. And this is it could be a very good drug to help you get into better lifestyle habits, make better lifestyle choices. It depends how people use it.
Should every woman be on HRT?
If safe to do so, yes.
Like that. In terms of menopause joint pain, are there any supplements that could help?
Vitamin D is a great one. So I always tell my patients, get a yearly MOT. You have it for your car, do it for your body. Go to your GP, ask for your blood tests. Get it done so you know your baseline levels. Vitamin D is great. And as we talked about gut microbiome and estrogen, your absorption and activation of vitamin D changes. It's reduced if your gut microbiome is not sufficient and you don't have sufficient estrogen. So it's good to keep getting that checked, but vitamin D supplements are great. Always speak to your pharmacist before or your GP before you do that. Magnesium is great because magnesium actually is involved in a lot of functions: glucose metabolism, sleep, relaxation. It stimulates the neurotransmitter GABA, which enhances, it reduces anxiety, promotes relaxation, things like that. But it's crucial for bone health. And about 50 to 60% of our magnesium is stored in our bones.
Wow.
Yeah.
That's a huge amount.
Yeah. So
what type of magnesium do you take? I'm just curious.
I take magnesium glycinate. So that's generally the best form. That's, where more data is. It helps me sleep. I love it. I take it every night. And I do feel a difference with it.
Yeah, same. I get sleepy about an hour later after taking it.
great.
I'm like, why am I so tired? Oh, that's very good. Can you still get pregnant during perimenopause?
Yes, because perimenopause is a time where your egg supply is running out. It's not completely over yet. So yes, absolutely, you can do.
I also have heard this thing, a couple of friends who are doctors say that some women who are over 40, perhaps they've already had a few children or a couple of children, they suddenly get the urge to have another one. And I don't know if it's just a mental thing of time, perhaps, running out in that sense, or the body's giving you a surge of hormones to tell you, look, like one last push.
Yeah.
But, I don't know if that's normal, but apparently there are a lot of broody women who are sort of in their perimenopause.
Yeah.
And even though they've already done that and got kids or decided not to have kids, suddenly get the urge to reproduce.
Yeah, because that's when it's sort of running out from 1 to 2 million at birth. By the age of 30, we have only about 3 to 6% left. By the age of 40, we're down to 1 to 2% of our
Egg reserve.
Yeah.
The last quickfire one, is menopause just a hormonal issue?
It starts off as a hormonal issue, but it's got much broader impact. So it's multifaceted, not just a hormonal issue. It's much bigger than that.
I love how much you know about the menopause and just the whole body aspect. I think that's really inspiring. And I think for women listening, to speak to someone like yourself could be a game changer in terms of the outcome. These few tweaks, this education can make all the difference. For anyone who's feeling lost, maybe currently not feeling supported by, perhaps they've had an appointment with a doctor, what would you say to them?
Find someone else who you can talk to. There are people in the NHS who do know about the menopause. There might be another GP in your surgery. Change surgeries if you need to. There are a lot of, I think, Instagram accounts or YouTube channels that also have professionals talking on this. So definitely you can go into that. But I like to say British Menopause Society is great. There is also, there are a lot of charity organizations such as Menopause Mandate and other organizations who put out a lot of information. There's an event in October coming up, the Menopause Conference, Pause Live. And that's one of the biggest menopause events. I'm speaking there. Come there because there are so many different stages, so many different areas you can explore for yourself. Do what, appeals to you. Get that information. And it's not particularly expensive. They have an offer going on at the moment. So yeah, get your information.
That's brilliant advice. Now there is so much information out there, there are so many tools, there are symptom checkers on various websites where you can look at some of your weird and wonderful symptoms and think, is this related to the menopause? How do you think or hope the conversation will change around menopause, perhaps in the next 5 years or so?
What I would like, I'm looking at piloting a project within the NHS at the moment. I can't talk about it too much, but hopefully that will make quite an impact. But other than that, I would love a world where it is mandatory, just like you learn your anatomy at university, like I did, and your physiology and the functions of all the organs. Every clinician that sees a female patient knows how her body works. I wouldn't treat a baby because that's pediatrics. I'm not trained in it. If you don't know how a woman's body works, how can you treat her? You don't know the impact of her hormones. So that would be an ideal world where every clinician knows. Every woman is taught in school since 2019. It's included in secondary schools, menopausal education, which is brilliant. But yeah, more education, more awareness, more research. We need more funding for women's health research because only until after 1993 were women included in clinical trials. So all our health advice is based off of men's health.
Yeah, it's mental.
It's mad. So more women die of cardiovascular disease than men do.
I love everything you said, and it feels like education is key. And then hopefully that will lead to more conversations, if it's normalized at school. So if boys and girls are learning about menopause in the school curriculum, then maybe it won't be so embarrassing for them when they are, in their 30s or 40s and potentially experiencing perimenopause symptoms. Absolutely. And it starts young, hopefully at home, they'll be able to talk to their mothers. It often happens where teenagers will clash with their mothers who are going through the menopause. It's quite a difficult time for the household often, and I think if there is more awareness there, that would help the kids realise, maybe mum's got a few things going on and that's okay, and awareness and conversations like this one hopefully will help shape the menopause dialogue in the future.
Definitely, conversations, like you said, are important. We have them in our household. My daughter, she's 6, and she talks about hormones. My poor husband has got PTSD about menopausal conversations because I talk about it so much. But yeah, that's exactly where it starts. Starts at home.
I love that. That's so amazing. I love that your daughter knows about it already at 6. That's amazing. Shreya, where can we find you online? So for people who potentially would love to speak to you or come and get you to check out their skin, or maybe they're having pains, where can they find you online?
My website is londonskintreatments.com. I am on Instagram as NHS Menopause Skin. I have just started a YouTube channel where I do little videos on different symptoms of menopause that you may not have thought are related to the hormonal changes. But yeah, so you can find me in those places. And yeah, to get in touch with me, my number is on the website. So feel free to get in touch with me, have a conversation.
Brilliant. I'll put all of those details in the show notes. So if you want to check out Shreya's website or anything else, go and check those out now. And I can't wait. I'm going to look at your YouTube channel. That's very exciting. I feel like you're brilliant at sharing your knowledge. So that'll be a great channel. Thank you. It's not as exciting as yours, but thank you. Thank you so much, Shreya, for coming on the Health Review.
Thank you. Thank you for having me.